TMS is something that it's called transcranial magnetic stimulation, and it is actually, how I explain it to people is that we used very high-powered magnets that are used in MRIs, and we use that to create a magnetic field which is able to cross the skull and enter the person's brain and create electrical stimulation. And I then explained to them that we used to believe that depression was a neurotransmitter problem, but now we're more thinking of it as a connectivity issue, and there are certain parts of the brain that are connecting with each other that are not working as properly as possible, and this allows us to go in there and stimulate that part of the brain to get it going. I've seen a lot of patients in my practice, and unfortunately there are times when the standard of care which we were providing and taught as psychiatrists just doesn't work. And I had a really tough time telling somebody, I'm not really sure what to do. So it was looking at different interventions that would be useful for these patients, and TMS was on my list. So the responses we've been seeing are really good. It's pretty much what it says in the literature. It's something upwards of 65 to 75% of people who have failed standard care, who are very sick, a lot of times depressed for years, getting better, and we've seen those results. You see somebody get better that has been so chronically depressed, and saying how they talk about life in this way, it's like, okay, I need to find more patients to treat because this is amazing. There's actually a patient right now that she's actually doing a testimonial for us because she's been depressed for years, and she's actually a pharmacist, which is interesting, and she's been on all different medications, and she said this is the best she's felt in her entire life. And it's the things that she's able to do now that she wasn't doing before. It's like she feels like a new person. Psychiatry was always something I really was interested in. Sociology as an undergraduate, I always wanted to understand why people do certain things, think certain things, and so when I was in medical school, it just seemed like a very smooth transition for what I was looking for. I think the best thing that we offer is that when you come to see us, you know that you're going to be interacting with people that truly care about you and that are going to be looking for whatever it takes in order to get you to a better place. We've had plenty of people come to us, and they really think of us as like their family, and a place that they go for support, and they feel like we have their back no matter what.